So our next speaker, Dr. Krishna Prasad, is a senior consultant, glaucoma, squint, oculoplasty services. I don't know what he's doing in cataract then, with so many subspecialties which he's manning from M.M. Joshi Group of Eye Hospitals, and a very admired figure for his tremendous surgical prowess and academic pursuits to talk on. So here he is going to tell us about the advances in the operative tools like NGT and RTVO. On to you, Dr. Krishna Prasad.
Thank you, Dr. Chitra and the team ARC. I think it's been so nice to be back here. It's so thoughtful of you with all the excellent surgeons honing up their skills, surgical skills, and so much of technology to help them. I think there has been an excellent marriage between the technology and the technique. I think what is missing is to have pushed the boundaries further. It is so thoughtful of you to have this program, because you have been coaxing all surgeons to excel better and better. I think with this to chip in, we also need to see things better. It's not just in the hands of the surgeon or the technology in terms of phaco machines or the femtoseconds. I think it's also to see better. So that is where this talk chips in. It's about, I think this is a very common sight in the OT, like we are struggling to, reach up to the oculars and trying to manage that. But this is how I do this surgery nowadays, okay, where I'm off the oculars. I'm a heads-up surgery looking at your large screen, and this is totally a different opinion. So I think sophistication in one's own art is a sophisticated pleasure. However, in surgery, it's a basic obligation. So we have to, as surgeons, evolve and do things better with time to come. I think the first one, the Alcon has commercialized this Ingenuity 3D visualization. That is a new way to look at the ocular tissues and to operate. So we are seeing it better, and we are doing it better. And the Zeiss also has a prototype as RTVO 800. It's a first digital microscope from Zeiss, which has all the components. Since I'm a user of Ingenuity, I will probably talk more about that. So let us meet the system. The system has a camera, which is probably the heart of the whole thing. It's a 3D high dynamic range camera, which captures the images. And we have a 3D 4K OLED display, a huge display screen, which can display the images what the camera captures. At the same time, the images can be processed with a high-speed graphic processor. It's simply that you take a photograph and do some photoshopping. It is not just the eye which are seeing, it is the computer graphics. At the same time, you have a passive circularly polarized 3D glasses. So a surgeon, so what is the advantage is, like you have an enhanced depth of field. For example, if this is the picture that you are seeing, you're only seeing things in the front, you don't have the things at the back are blurred. But if you can see everything at once in one shot, it would make a lot of things easier for the surgeon. At the same time, different quality pictures, like one is overexposed, other is underexposed. Instead, if you have an all immersive environment where you see everything in the right shade of light. So this is where we have the digital visualization. I think you have known with these standard SD screens, which gave us to enhanced definition, then the HD screen, and now you have the typical home theater feel where you have the digital era taking over, the way we see things. So what is very important is when you magnify something, you need to also perform better. With this, we normally lose the picture, but if we can see things like this at this magnification. Similarly, if you're seeing the bark of a tree, if you're seeing with this much detail, probably things they look much better. At the same time, when you look through a microscope, you see only the central part. When you zoom it, you lose the periphery. But if you can see everything at once, probably your ergonomics can work much better. At the same time, I told you about the photoshopping. This excellent versatile camera and the CPU and the graphic processors can actually do the photoshopping, can make you see in a much different tone, different hue, different resolution, different saturation. What is very important is we have this professional hazard of our neck and back and the shoulders getting the brunt of our marathon surgeries. There's a movie called MSD, The Untold Story, but this MSD is the musculoskeletal disorders, which is an untold story of surgeons. So we all try to crouch onto our microscopes, we lose the lumbar lordosis, our necks are cantilevering. I think this is an untold misery where we have a lot of problems in our OT. The ergonomics takes a hit. But look at our South Zone ARC person who is actually leaning onto his chair and looking at the screen, doing a complicated vitreoretinal surgery, looking so easy and so nice. I think with the ingenuity has really come a long way with trying to imbibe all the new things that technology can offer. This is just a comparison between the prototype, the most important or the most the upscale Lumira 700 from Zeiss. So it's just a comparison between the two. Like an Ingenuity 3D system offers around 26 to 48% greater magnification compared to an analog microscope that is Lumina 700, and more than 5 times the depth of focus and around nearly 11 to 43% fine depth resolution. This is just a video to show, like once you are actually seeing it through an analog microscope, when you actually zoom it, you tend to lose the blurring. There's a blurring of this bottle. That means they are in different depths. When you actually zoom it up, you tend to only see this better, not the other way around. But instead, if you're seeing through an Ingenuity system, like even if you zoom it even to a higher level, say I'm zooming it further, still you can see both of them very clearly. So this is the advantage of Ingenuity, where the depth of focus comes really in the way. Similarly, the Zeiss RTBO 800 also has, it can also include the intraoperative OCT. I think Dr. Srinivas Joshi can add on more in the discussion that he has regularly uses intraop OCT. And we also have Dr. Tityal who will be talking about intraoperative OCT in the cataract surgery domain. I think this is an excellent marriage of technologies where the two things can really go a long way. At the same time, with the Callisto coming into this, we have all the parameters on the screen. So without looking at the microscope, you can even align your toric eyeballs with your Zeiss RTBO 800. And also, it is what is very important is the cloud is the way to go. By all the instruments of your OT talk to each other without creating any kind of problems in communication of the technology. So what is very important is it's a new thing. It is a new impetus for a surgeon to get to the OT and do things better. If you see better without straining your neck and back, actually you perform better. So that is where this fusion of data, I told you, various options, various gadgets in the OT can actually interact with each other. So this is just an example of how we do a cataract surgery, wearing a posh looking dark glasses. And this is where you can see, I'm just talking about the amount of information that you can see in one shot. You see everything in and around the eye, and you are doing this without, there is a little bit of learning and relearning that is required for beginners, and excellent surgeons do not really take more than a day to get used to this heads-up cataract surgery. I think this is really a boon for vitreoretinal surgeons. The same can be told about even the anterior segment surgeons also. I think the cornea surgeons with an intraoperative OCT attached, it can be a great boon for all kinds of cornea procedures like the lamella surgeries. So the cataract surgery has really made a turnaround with this. But what is very important here is when you have bad corneas, these are the corneas where we have stitched it up because of a corneal tear, a corneal trauma. Normally, analog microscopes reflect a lot of light. You don't tend to see anything inside the eye. So doing a cataract surgery would be very difficult. We have Dr. Namrata Sharma who has done excellent work on how to do intraocular surgeries with bad corneas. But we call it as window of hope. This is where your 3D visualization, especially Ingenuity system, you can actually see a lot better inside the eye despite having a bad corneas. I think this is a very all immersive environment where everybody is involved in it, and everybody gets a real-time view of what is happening in the OT. I think there's a surgical collaboration. Your assistants will know what is happening. Your scrub sisters the nurses will know. So there is no problem in communicating. There's a good, better communication, a workflow, and there's a learning environment. And I also do, other than cataract, many more things. And this is a great tool to do orbital surgeries because of the area that it can cover. So for oculoplasty surgeries, especially orbital and lid surgeries, this is a great tool. And obviously, if you have trainees around you, residents and colleagues, It's a great way to teach. The surgeon cannot
A 1
mask
minute
anything.
remaining.
Yeah, you cannot really hide anything. Everybody sees what's happening. So you're very honest, you're very transparent, and at the same time, you can actually teach your trainees really what's happening. So this is one of the greatest tools that we see as a training center. But what is important? What about the lag? Is there a lag? We see something and it happens a little later. So I think lag is something, anything that happens, takes less than 60 microseconds, milliseconds, sorry, we will not be able to register, our brain will not be able to register. So presently the technology has reached a stage where this lag is a non-entity. And as we told, the diffusion of innovation, see the early innovators, early adopters will normally ride the ladder and go up. And the people who do not really fall in or really do not, they become laggards, and this is how it happens. So the story from Nokia, they missed on learning, they missed out on changing. Change is the only constant in life, and they lost their chance of survival. I think that is where we matter. We need to change with time. We need to see things better. We need to use the digital innovation, digital technology to Photoshop or images and see better than what our human eye can see. And that will basically translate into better surgical outcomes for better training. Thank you very much.
Thank you very much, Dr. Krishna Prasad, for covering most of the questions you had, and a warm welcome to Dr. Mahipal for joining us a bit late though. I just wanted to ask Dr. Krishna Prasad or anybody else could chip in. Do you feel that, yes, we are doing good cataract surgery without this facility? Do you think it would have a greater value in corneal procedure or probably retina surgeries as against the others because of increased depth?
Obviously, your microscope cannot be delegated to only one aspect. I think it's in an institute. You will use it for your vitreoretinal surgeries. You will use it for corneal surgeries and also for cataract surgery. Majority of our surgeries are cataract. So obviously, cataract you can do very comfortably under 3D visualization. But as a technology, it is best suited for and corneal surgeries, especially with associated intraoperative OCT. But once you probably get to start doing, cataract surgeries without looking into the microscope oculars, I think it's a great feeling. It's a great feeling at the back, neck, and once you probably get onto this, it is really, really very, very addicting. At the same time, it is not basically for the patient. Obviously, the outcomes of the surgery may not change much with expert surgeon, whether they do to an analog microscope or to an NGDT or a RTView. It is basically for the surgeon. I think you have spent a lot of time for making things better for the patient. It is time that the surgeon should also have a due credit to have their, have a more luxurious stay inside the OT and to operate with much better ergonomics. I think that is where this course and probably can justify the cost involved.
Can I chip in?
Yes,
Chitra,
yes,
can
sure.
I chip in? Because I think I decided to chip in because I'm the latest entrance into this club. So I just started using this RTO 800 exactly for the last 7 days. I'm absolutely thrilled with it. As Krishna Prasad said, of course, it makes an enormous difference for cataract. I didn't believe it would make something for the glaucoma surgeon. We did a few glaucoma surgeries, raising the flap, doing the trabeculectomies, amazing difference. And my VR surgeons are just over the moon with it. There's nothing that, and I don't know about the lag. I don't see any lag with the Zeiss system, zero. It's brilliant. But as Krishna Prasad said, does it really make a difference to the patient? Yes, low light, we use such low light that the patient is very comfortable. Surgery goes on a little faster actually, and suddenly you feel that you're operating in a football field. That anterior segment, the anterior chamber suddenly feels fully expanded and you know exactly where you are doing everything. It's a completely different experience, and in a matter of 8 or 9 days. The other thing where I actually disagree with Krishna Prasad is that there's a learning curve. I put my 3 fellows on it off the bat. They've never seen this product in their life. And they just finished, start to finish their first phaco, no issues. And the junior most fellow had done only 60 phaco so far. And she just went on and just like luck to water, nothing, start to finish in a matter of minutes. And she was out and she was thrilled with it. their understanding of depth and the field of
KP,
Ma'am, I wanted to
KP, I
ask.
had a question for you.
Yeah.
Yeah, Namrata, come on.
I had a question for you, Krishna Prasad. You have
Yeah,
both the systems. You have Ingenuity and you have Zeiss. What do you think is the difference between the two, and which one do you think is better for, which kind of surgery?
So we have Ingenuity and Arul has RTVO. So we both have to sit and answer the question together.
So I think we would leave this. We have also used this machine. I am going to ask Dr. Mahipal this. Do you think this actually has a future potential in?
I wanted to ask him only.
So that's why I said.
Namrata, your voice is not coming off clear. I think your network is not good.
I think Mahipal sir can chip in. I think he has the.
Mahipal sir has been always in the forefront of new technology, sir. So we want to know what is your view about
this. He's lacking in technology. I don't know why.
Unfortunately, I don't believe in this technology too much, so that's why I have not purchased it or used it. But I don't know, since all of you are going gaga about it, maybe I can.
No, sir.
All of us
Sir,
are
you should try, sir. It is here to stay, and I think this is the future.
Great. I think.
Just one point I wanted to make, Chitra madam, is
it's like a intro. It's like a intro of diagnostics. You don't have to take the diagnostics part after the surgery. It just happens with the surgery. So I think it is here to stay, and especially for corneal ocular surface surgery, it is a great tool. I think it has really refined all anterior segment surgeries. I can't say about posterior segment because I don't work on it, but all anterior segment surgeries have been hugely fine-tuned by this.
Nowadays, I am laying my hands on the intra of OCT with the Zeiss microscope. So I think it's great for making presentations, but otherwise it's more time consuming and things like that. I really don't know whether Detail is laughing.
You need to get used to it.
Laughter has some realism in it.
So just to answer Chitra madam's question, the Ingenuity was first developed for VR. Yeah, I have to be very frank on it. It was developed for VR. And later on, because the earlier surgery, when you were able to do a cataract surgery, it was always like operating in a well. But now with the CR 1.4 software, which has come just 20 days back to India, and we are using that, and it's definitely looking a lot much better. Secondly, any cataract surgery can be done even with the upper microscope also. The challenges comes is when you have the adding of the color channels, when you have adding of the light profile, and now it has come out with a temperature bar where you can change from 3500 Kelvin to 7000 Kelvin. And once you are able to do a cataract surgery, good cataract surgery, even a white cataract without using the dye, with the addition of these colors, I think that becomes a kind of changing of the technology. They are working on that, and probably with the now present software, it's going good even with the cataract surgeries as well.
Okay, just a question. Arul, where is Arul gone? How expensive is it now? Have the prices come down?
No, people, you can choose to upgrade on your existing machine, so that way it becomes cheaper. If you want to buy the whole unit, it is enormously expensive.
He will not disclose the buying price, sir.
That's what I'm doing. What is enormous now?
Okay, if you're buying the whole unit, that means you're buying the RTO 800 with the intraoperative OCT, it's almost 4 crores. If you take off the intraop OCT...
Have you bought it with the intraop?
No. I'm sorry. I did not buy the intraop OCT. I did not buy the... I bought only...
But Mahipal sir, to be frank with you, if you are a Centurion lover, you should go with it because it is coming with the integrated cataract suite. The Centurion, all the modules are being put up on the Ingenuity screen, and it will be easy for you to just send the feedback between the Ingenuity with this. Because see, most of these phaco machines are now better well with the Alcon, and with the 3D visualization with them, getting an integrated suite, I think it's always better.
Okay.
Thanks a lot, but I think we have a lot of good talks ahead. So this controversy would continue. We all know, none of us deny how fantastic the technology is, but we